Usually when you have peri-implantitis, the tissue around the implant is tender, so if you were to brush it or water pick it or something like that, it would bleed and be sore. So intuitively, patients just shy away from it. But the problem is much bigger than it looks, because it's a broader loss of bone around that implant than just a very thin veneer of bone next to the implant. It broadens out almost like a volcano in reverse. Often we just have to remove those implants and regraft it, rebone graft it, and then replace the implant with a new implant. Or take a look at the whole CAT scan and see whether they really even need anything there or not. If they do, we'll replace it. If not, they may just end up being a righty instead of a lefty. The mouth, eat food, drink water is essential, so it'll switch dominance. So sometimes it's really bad that you're losing the implant that you had, and sometimes it's not. But we do have treatments for it that I use lasers with, and every once in a while we can calm that peri-implantitis down and get it to heal. If they're okay, they're okay. If they're not okay, they're not. We change them very quickly. We don't let people wait until we see a failure, per se. I mean, does it always work? No, so we switch it up. We put a smaller implant, even though we could have put a larger one, because there's just too much hard, dense, non-vascular, no blood vessels in the bone. You have to be careful. So you have to have the CT scan, you have to have advanced testing to really assure that you're not going to get peri-implantitis. That's really the best answer. Not what is the patient going to do. The patients don't know. They really don't. They're watching this, you don't know. You're not going to know. You're going to have to go to someone professional to find out whether your arteries around your heart are clogging, whether your implants are failing. You're going to have to do that. You can't just assume they're okay because you're brushing your teeth and you're eating normally. You just can't assume it. And the first 18 months to 2 years is really critical. It really is.